Hello and welcome back to A World Without Malaria. In this fourth chapter of the series, we're going to discuss uncomplicated malaria. Uncomplicated malaria is when a person shows the symptoms of malaria, but the malaria hasn't drastically affected any of their major organs. In Chapter 8, we look at severe malaria, which is when malaria has progressed and can kill people really quickly. I encourage you to take notes as we go through this video. That makes it easy to refer back to this chapter and quickly find important information during the rest of the series. Of course, you can always watch the video again to help you remember. But for now, enjoy.
Hey, my name is Florence. We have previously explained that there are 5 types of malaria that affect humans. Do you remember them? The first is Plasmodium falciparum. Remember? We abbreviate this to PF. Then there is Plasmodium knowlesi, which is PK, as well as Plasmodium malariae, PM, followed by Plasmodium ovale, which is PO, and finally PV, which is Plasmodium vivax. All types of malaria are dangerous and should not be taken lightly, and particularly if the type of malaria is PK or PF, the possibility of severe complications is quite high. So, what is uncomplicated malaria? Uncomplicated malaria is when a person displays the symptoms of malaria, but it has not yet drastically affected the major organs of the body, such as the brain, liver, lungs, or kidneys. It is important that all malaria is treated quickly with the correct medication, as it can rapidly move from uncomplicated to severe malaria. A person can very quickly be in danger of very serious complication or death. So, there are many symptoms of malaria. Some people have lots of symptoms at once. Others may only have some. Listen well. The primary symptoms of malaria that are common to all the different malaria species generally begins with looking a bit like when a person has a bad flu. A person with uncomplicated malaria may experience chills and fever. They will have a high temperature with cold chills and shakes that are due to immune system attacking the malaria parasite in the blood. During the malaria cycle, when the parasites hide in the red blood cells, the chills and fever die down. But when the parasite explode out of the red blood cells again and are present in the blood, the chills and fever come back. The patient will feel unwell before having a fever and may have any number of the following symptoms throughout the illness. They may have a mild to severe headache. They will probably have muscle aches. They will be nauseous and feel like vomiting. They may have diarrhea. They will have an increased heart rate. They will feel weak and most likely will have an increased breathing rate. It is important that a person who is exhibiting these symptoms is tested to confirm the malaria diagnosis and to find out what type of malaria it is. Different types of malaria are treated with different drugs, and if a patient is not treated, the malaria can quickly become serious malaria. Once a person is diagnosed, the next step is for them to take the correct medicines. These would generally be given as tablets or as an infusion. Alongside the medications, it is important that a patient is supervised to make sure they are responding well to the medication. A person should not just get some medicine and go home unsupervised. Besides the medicines that treat malaria, the doctor may give vitamins to further strengthen the body and help it to fight the malaria infection. The correct dosage of Panadol may also be given to help with the pain. Now, some medicine will have a quick effect and the patient will start to feel better. It would be a tragic mistake if the patient stopped taking the medicine because they feel better. All the medicine have to be taken as prescribed, which means the correct dose at the scheduled time until they are all gone. Some people who stop taking the medication too early end up being sicker because the parasites have not all been killed and started multiplying again. Also, not taking the full course of medication contributes to the parasite becoming immune to malaria medication, which is a tragedy that creates greater problems for future malaria treatments. Check out chapter 13 for more details on malaria medication. All kinds of malaria can trigger anemia, so it is important to treat a patient accordingly. We covered the topic of anemia in chapter 5. And now listen well. People with malaria will not want big meals, but it is important to support the patient's recovery with as much nutritious food as is practically possible. If they are unable to take standard meals, they could be fed small amounts of nutritious food like chicken or rice broth to help them regain strength. Vitamin tablets dissolved in water for them to sip might also be helpful. Even after initial recovery, uncomplicated malaria can cause ongoing weakness. It may take a patient some weeks before they are back to full strength again. All patients suffering from malaria or who are suspected of suffering from malaria need to be kept under a mosquito net. This is very important for the protection of others. The mosquitoes who bite patients who are known to have malaria parasite in their blood will pass on those parasites to others. It is essential that the patient rest under a mosquito net. We talk more about mosquito nets in chapter 18. Now, finally, even though we use the word uncomplicated, which might suggest not threatening, nothing could be further from the truth. Uncomplicated malaria is a terrible disease with debilitating symptoms that can quickly become serious if the correct steps aren't taken to treat the patient and assist in their recovery. For now, I think that is enough for you to think about, and I hope this short presentation helps you in developing your understanding of uncomplicated malaria. So, bye for now.